Hi everyone, my name is Lauren, and in this video I'm going to be talking a little bit more about medications, and so what kind of medications are available for schizophrenia, as well as medication adherence. So taking medications is something that I struggle with quite a bit, which I talked about in a previous video. But one of the delusions that I experience quite frequently around medications is that doctors are conspiring to use them to poison me or use them for mind control over me. So it's definitely something that I struggle quite a bit with. I currently take 2 antipsychotics, one through an injection and one orally. Hopefully it'll get to a point where the injection stabilizes so that I can just be on that, but for now I need to be on the oral antipsychotic as well. Medication is fairly key in managing schizophrenia, though I know that there are individuals out there who are able to manage it without medications. I would absolutely love to know more about that and about how you are able to do that, but for now, medication is important for me to take. The medications doctors most often prescribe for schizophrenia are antipsychotic medications, which help to ease hallucinations and delusions as well as some of the other symptoms. These drugs work on chemicals in the brain such as dopamine and serotonin. There are 2 groups of antipsychotics, the first being first generation or typical, and the second being second generation or atypical, which are the newer drugs. So the first generation antipsychotics typically have worse side effects, which can include lethargy, sometimes drooling, and increased prolactin levels, which can affect a person's sex drive, mood, menstrual cycle, as well as it can increase or promote the growth of breasts in men. One of the most common side effects with the second generation antipsychotics is weight gain. This can be really problematic and can lead to other health problems as well. So for me, I started a new medication about 2 years ago, and I quickly, in a very short span of time, gained around 50 pounds. It was really difficult, and so figuring this out and making the decision to switch to a new medication, it was what I did. I then also had to focus a lot more on exercise and nutrition to kind of counteract this side effect. A more serious side effect that comes with prolonged use of antipsychotics is what's called tardive dyskinesia. So this is a movement disorder which affects facial, neck, and tongue muscles and causes them to move uncontrollably, and it can be permanent. So it's really important to have an open dialogue with your doctor around your concerns and desires for your medications. It's really important to know that you absolutely have a say in determining your treatment plan as well as what works best for you. And it's really best when you can work together with your doctor to come up with what is the best approach for you. So it's important to remember that it is a little bit of a guessing game when it comes to psychiatric medications and finding what is the best fit for you. So it may take trying a multitude of different medications before you find the one that works best for you. It took several years for me of trying different medications before I found the one that was the right fit for me. And I'm still making adjustments and changes in order to deal with different side effects and symptoms that come about. So schizophrenia can make it really hard to stick to a medication regimen. I struggle with this quite a bit, which I mentioned earlier, but having a strong support system is something that can really help with this. So for example, my boyfriend checks in with me regularly around medication and offers me encouragement when I need it in order to continue taking it. He made this really wonderful little poster that I keep beside my bedside where my medications are that just kind of outlines why I need to take my medication and why it's going to be helpful for me to continue taking my medication. And that's really helpful for me. Adherence is another really important thing to talk about. So it's quite common for people to be, or to start taking medications, and then when they start to feel better, to just assume that they don't need to take medications anymore. This is not the case though, and it's really important to remember that the medications are what is helping you to make you feel better. So not to go off of them and not to change anything up without first consulting with your doctor. So unfortunately, taking medication can kind of suck. So it leads to different side effects, like I just received my injection a few days ago and I'm still feeling the effects of that. So I'm feeling a little bit more lethargic, my arm hurts, I'm feeling a little bit out of it still. And it can also lead to different things like dry mouth, which I'm experiencing right now actually, weight gain like I talked about, as well as the other symptoms or side effects that I discussed earlier. Also, the unfortunate reality is that medications don't cover all the symptoms that you're going to experience. So you're going to end up having breakthrough symptoms while on medications as well. But the key part here is to find a way to balance the side effects with the benefits in terms of symptom relief that you can receive from the medications. And finding that balance is crucial. So I hope this video helped you to better understand a little bit more about what taking medications can look like for schizophrenia or schizoaffective disorder, as well as some of the benefits as well as drawbacks to taking medication. Thank you so much for watching, and if you want to see more videos, make sure to subscribe. Hope you have a great day. Bye.